Well, I was born with congenital heart disease and PH, but I was not diagnosed until I was 9 months old. So I grew up constantly getting echoes to make sure my heart was okay, and I have 2 holes. My defect is atrioventricular canal, which is an ASD and a VSD. I've always kind of kept my symptoms to myself sometimes. The shortness of breath, the fatigue, the blue. I was always blue, cyanotic, always blue lips. Everybody commented on my blue lips all the time, or fingernails or toenails. I still was having a lot more chest pressure, pain, shortness of breath, even more than I ever did. And the cardiologist I had seen all my life had tried me on asthma meds. Even though he was aware that I had PH, but I'm not sure if he knew enough. So when I was diagnosed, I mean, back in 1975, there was nothing. It's just a name and good luck, pretty much.
When I was born, quite obviously, people didn't, my mother didn't know, but I was probably a blue baby, and I got very sick with colds and things like that. When I was about 6 years old, they realized that something was very, very wrong with me. So I always say I grew up in the children's hospital. It's because I had my first 3 heart casts at the age of 6. Then I had another one at the age of 12. And then I had my first open heart surgery at 23. So I could never have children. And I know that a lot of people with pulmonary hypertension, a lot of young women, it's quite devastating. I was devastated. I wanted 5 kids. And people look at me and they say, "You look so good." And it's wonderful, yes, thank you very much, but when you feel really lousy, it's very isolating, because people say you're so lucky to be so healthy. If you only knew what's happening to the patient, how difficult it is. It's not just the tests, the tests reveal certain things, but what's happening here, how does it feel? How does it feel to be so uncertain about your future, to not be able to have children, to have diminishing exercise capabilities, to go through really rough days.
We have a number of epidemiologic studies that have looked at patients with congenital heart disease, trying to determine what percentage of those develop pulmonary hypertension. It appears it's probably between 5 and 10% of congenital patients that will eventually develop pulmonary hypertension. This is the real challenge in congenital heart disease, is that patients tend to say, oh, I have a congenital heart lesion, and therefore these are the problems I'm going to have. But realistically, usually folks are pretty stable over time. So when they start developing more shortness of breath, when they start recognizing that they can't do what they were able to do in years past, that things become more labored, it's more difficult to get up and down the stairs, it's more difficult to do things that they were normally accustomed to, and everybody's got a different baseline. Somebody that runs every day, they suddenly can't, go that extra mile or whatever they were doing before. That may be a sign that something is going on. Not only do the physicians miss some of these symptoms sometimes when the patients are coming in because they're not asking the questions or the patients are not telling them, but the patients tend to downplay it as well. So really it's to be able to recognize this requires a very astute doctor and an astute patient. The patient has to recognize that something's going on that's different, and it really has to vocalize that to their doctor.
Yes, I have had down times where I wish this hadn't happened, but now it's very few and far between, because you learn to live a new normal. I have learned that from PH friends I've met.
I'm really, really, really strong on support groups, because it's a very, very isolating disease. And I think you find that people get in a better and better frame of mind as they exchange.
You really have to be your own advocate. And if you're having issues and your doctor doesn't understand, you have to understand yourself, kind of what's going on, your symptoms, so that they, will hopefully steer you in the right direction.
Folks with congenital heart disease, particularly the Eisenmenger patients, have a lot of symptoms. They're very limited in what they can do, and these medications are really a godsend. I mean, you can go from getting short-winded walking up and down a flight of stairs to suddenly being able to go to the grocery store and do your groceries and get around. And I mean, improving one function class can have a dramatic impact on quality of life. And so, I would say the stress points are, yes, the outcomes may be a little bit better than idiopathic pulmonary hypertension, but with treatment, they're so much better. So that's why it's so important not to disregard this, and if you have a diagnosis of pulmonary hypertension, to see the right doctor to make sure that you're being treated for this, because it can make a big impact not only in terms of longevity, but in terms of quality of life.